Today's ICD-10 quick coding tip focuses on what you need to know about coding hypertensive heart disease. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Hypertensive heart disease refers to heart conditions caused by elevated blood pressure. The heart having to work under increased pressure can cause a variety of cardiac disorders, including heart failure. ICD-10 has specific guidelines for reporting hypertensive heart disease and associated conditions. The classification presumes a causal relationship between hypertension and heart involvement because the two conditions are linked by the term with in the alphabetic index. These conditions should be coded as related even in the absence of provider documentation explicitly linking them, unless the documentation clearly states the conditions are unrelated. The guideline for hypertension with heart disease states that hypertension with heart conditions classified to I50 or I514 through I517 or I5189 or I519 should be assigned a code from category I11, which represents hypertensive heart disease. This is because there is a presumed causal relationship between hypertension and heart disease. Whenever hypertension is present along with any of the conditions classified to the codes listed in the guideline, and no other cause has been specified, the code for hypertensive heart disease should be assigned. This is an assumed link in the absence of any other documented cause. However, if the provider specifies a different cause, the condition should be coded separately and not linked to hypertension. The codes for hypertensive heart disease include codes for either with heart failure or without heart failure. When heart failure is present, an additional code from category I50 heart failure should be assigned to identify the type of heart failure. Let's take a look at some examples of how documentation of hypertension and heart failure in the medical record is coded as related in ICD-10. In this case, the patient has been diagnosed with both heart failure and hypertension. The hypertension was noted in the history and physical, while the heart failure was documented in a consultation note. Heart failure and hypertension have a presumed causal relationship in ICD-10, so although the physician did not explicitly state that the heart failure is caused by the hypertension, we will still assign the code for hypertensive heart disease with heart failure because no other cause has been documented. We can find these conditions linked in the alphabetic index. Starting with the main term hypertension, we see that it is immediately followed by the subterm with. Under this subterm, we see an entry for heart failure, which instructs us to assign code I110, hypertensive heart disease with heart failure. Next, we consult the tabular to verify the code assignment and check for instructional notes. And we find an instructional note instructing us to use an additional code to identify the type of heart failure. Therefore, we assign an additional code to identify the heart failure. Now let's take a look at an example for a patient who has hypertension and heart disease, but does not have heart failure. In this case, the patient has been diagnosed with both heart disease and hypertension. The hypertension was noted in the history and physical, while the heart disease was documented in a consultation note. Starting by looking up the heart disease in the alphabetic index, we can see that the code for heart disease is I519. Now remember, the guideline for hypertensive heart disease tells us exactly which codes have the presumed link to hypertension. Upon reviewing the guideline, we find that the heart disease code falls within the listed codes, and as no other cause has been documented, we will assume the link to hypertension and assign the code for hypertensive heart disease. Next, we look up main term hypertension and go to subterm heart, since we know that in this case we will be assigning the code for hypertensive heart disease. We can see that the code is I119. Checking the codes in the tabular, we see that we have arrived at the correct code and that category I11, hypertensive heart disease, includes the condition from I519, and so only the one code is needed to capture both the hypertension and the heart disease. I want to emphasize that the connection between hypertension and heart disease is only applicable to the specific codes mentioned in the guideline and that are linked in the alphabetic index by the term with. It's important to note that there are various other types of heart disease that are not covered in the guideline, and therefore there's no assumed link to hypertension for those conditions not mentioned in the guideline. In this example, the patient has been diagnosed with both coronary artery disease and hypertension. When we refer to the code for coronary artery disease, we find that there's no subterm for with hypertension and that the code for this diagnosis is I2510. Now, checking in the guideline, we can see that this code is not among those specified, and so we should assign separate codes for hypertension and coronary artery disease. Last, let's look at an example of how hypertension and heart disease becomes unlinked if the provider has specified a different underlying cause. In this case, the patient has been diagnosed with both heart failure and hypertension. The hypertension and heart failure were noted in the history and physical. A cardiac consultation was done, and the cardiologist documents chronic systolic heart failure due to ischemic cardiomyopathy. In this scenario, the provider has specified a different cause for the heart failure other than hypertension. Because the heart failure was specified as being due to ischemic cardiomyopathy, the condition should be coded separately and not coded as hypertensive heart disease. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.